Hello, my name is Mohsin Bart. I'm a final year medical student here at Barts in London, and I'm going to talk to you all a bit about how I spent my summer vacation following completion of the Year 4 MBBS programme. So I was very grateful to have been given a travel vacation scholarship to visit another country, and I chose to visit Pakistan, but specifically the National University of Medical Sciences, which is based in Rawalpindi, which borders the capital city of Pakistan, which is Islamabad. So, why did I choose to visit Pakistan? Well, there were two key reasons why. Firstly, I was quite keen to see how medical research is conducted in the developing world and to compare and contrast that to the medical research that's conducted here in the UK. And secondly, on a more personal level, I was quite keen to visit the land of my forefathers. So I'm ethnically from Pakistan. Both of my parents migrated to the UK when they were very young, and they have very fond memories of their childhood in Pakistan, and I've always been keen to visit the fourth, fifth and sixth cousins that they always talk about, but who I'd never actually seen before. And I also heard really good things about Pakistani food as well. I wanted to go for a bit of a taste test and to see how Tayyabs and Needus in Whitechapel compared to real genuine Pakistani food. So I've been working with Prof. Kazim Aziz at the Wingate Institute of Neurogastroenterology for several years, and the principal focus of my research was to investigate the relationship between hypermobile Ehlers-Danlos syndrome and functional gastrointestinal disease, such as irritable bowel syndrome. But I was quite keen to stray away from gastroenterology and to research a bit about tuberculosis. And the reason for that was because there's quite a high prevalence of tuberculosis here in the East End, and I'm hoping to work in the East End when I'm older as well. So I wanted to understand a bit more about the therapeutic strategies and the management strategies that we have in place in order to control and prevent the transmission of tuberculosis. And so Prof. Kazim Aziz introduced me to Dr. Sidra Yunus, who's a postdoctoral research fellow at NUMS who was visiting QMUL. And Dr. Yunus was conducting some research in Prof. Martineau's lab at the Centre for Primary Care and Public Health at the Blizzard Institute. And together, Dr. Sidra and I designed two studies that I could conduct whilst I was out in Pakistan. So we were quite ambitious when we designed the study. So we had hoped to conduct two studies. The first study was a study exploring a novel microbiological marker for the diagnosis of latent TB infection. And secondly, we wanted to conduct a study using data collected by the National TB Programme in Islamabad, and to see whether there was a relationship between seasonality, latitude, and prevalence of TB across Pakistan. Whilst out in Pakistan, we achieved some really important milestones. So firstly, we established collaborations with consultant respiratory physicians who would be the source of patients for our study investigating a novel microbiological marker for the diagnosis of latent TB infection. We also wrote ethical approval forms and had those approved by the Institutional Review Board. We also sought grant funding from NUMS, and we're very grateful to NUMS for continuing to support our study into next year. And we also took some blood samples from patients as well. Together, Dr. Sidra and I took blood samples from 5 patients, and we also processed those blood samples as well. And when I left Pakistan, Dr. Sidra continued to take blood samples, and now we've completed participant recruitment, and we've got around 40 patients' blood samples, so that's a fantastic achievement. I've learnt some really important lab skills in the process, and I think those will really complement my clinical skills. So firstly, I learnt how to collect and prepare blood samples in a sterile fashion. I learnt how to maintain and calibrate equipment in the lab. I also learnt how to order and also maintain stock in our resources cupboard. I learnt how to record and analyse data, making sure that it was in a presentable format, and I also presented those preliminary findings to senior staff members. With regards to the second study, which was a study exploring the relationship between latitude, seasonality and tuberculosis in Pakistan, we collected all of the data, decades worth of data from the National TB Programme, and we're currently in the process of statistically analysing that data to determine whether there is indeed a trend between seasonality, latitude and the prevalence of TB in Pakistan, and that's hopefully going to be due for publication in the near future. Visiting Pakistan was an incredibly enriching experience, both in a professional sphere and in a personal sphere, and I would really recommend all medical students apply for the travel vacation scholarship and to go to a developing country. And to see how medical research is conducted where there is a relative paucity of research infrastructure. By way of an example, I had to sterilise equipment myself. I had to ensure that the lab space was clean, and those are things that we take for granted here in the UK. Lastly, I was not at all disappointed by the food that I was served in Pakistan. As a tourist, actually, they are very, very hospitable people, and I can count on my fingertips, my fingers here, the number of times that I had to pay for food in a restaurant. Most times it was actually free once they realised that I was from the UK. They are incredibly hospitable people. The food, compared to Tayyab's anyway, is just in a league of its own. Definitely go to Pakistan, definitely go to the developing world to see how medical research is conducted, and definitely go and eat some Pakistani food.